give you one option only. It should be always between L1 and L2. The gonadal arteries, whether the testicular in the male or the ovarian in the female, are at level L2. The inferior mesenteric at the level of L3. The lumbar arteries, we have 4 lumbar arteries, L1, L2, L3, and L4, okay? And we have the terminal branches of the aorta. The aorta divides at between level L4 and L5. But also, if you have a single best answer question and asking you to pick up where the aorta bifurcates, then it's closer to L4, closer to L4 level. And of course, the terminal branches of the aorta are the right and left common iliac, and we have a single middle artery. It's called the median sacral artery. So we have a right and left common iliac, and we have the median sacral artery. So these are the branches of the aorta. Of course, we know that the aortic hiatus, and I think we are going to mention that in embryology again, the aortic hiatus is corresponding to T12. I mean the opening of the aorta at the diaphragm. Okay? Because the diaphragm are pierced by the aorta, the inferior vena cava, the esophagus, and each hiatus is corresponding to certain vertebral level. The aortic hiatus is corresponding to T12. And from the notes, we need to know that the right common iliac artery is 1 centimeter longer than the left, and it crosses directly in front of lumbar 5 vertebrae. Each common iliac divides into external and internal iliac arteries, and this division occurs at the level of the sacroiliac joint. So the common iliac becomes external and internal iliac arteries at the level of sacroiliac joint. And the external iliac artery will continue as the femoral artery at the inguinal ligament. It passes under the inguinal ligament midway between the pubic symphysis and the anterior superior iliac spine. And we call that the mid-inguinal point. So what is meant by the mid-inguinal point? The mid-inguinal point is a point halfway between the pubic symphysis or the symphysis pubis and the anterior superior iliac spine. And this mid-inguinal point is 1 centimeter medial to the midpoint of the inguinal ligament. So there is a difference between the mid-inguinal point and the midpoint of the inguinal ligament. Midpoint of the inguinal ligament is the point that bisects the inguinal ligament to 2 halves, okay? This is called the midpoint of the inguinal ligament. But the mid-inguinal point is a point in the inguinal region, which is halfway between the symphysis pubis and the anterior superior iliac spine. Also, the common iliac vein joins, or the common iliac veins, both right and left, join to form the inferior vena cava at the level of L5. And the inferior vena cava pierces the diaphragm at the level of T8. This is the inferior vena cava hiatus in the diaphragm. It's corresponding to thoracic 8 vertebrae. So these are important notes we need to consider for the exam. Regarding the internal iliac artery, at the level of the upper margin of the greater sciatic notch, now we are talking about the internal iliac artery itself. It divides into anterior and posterior divisions at the upper margin of the greater sciatic notch. Posterior division gives these terminal branches. The superior gluteal artery, we need to remember the branches, superior gluteal, lateral sacral, and the iliolumbar arteries. Superior gluteal, lateral sacral, and the iliolumbar arteries. These are the branches of the posterior division of the internal iliac artery. Regarding the anterior division itself, it gives other branches. They are the umbilical artery, the uterine artery, the middle rectal, the inferior vesicle, the obturator, the inferior gluteal, and internal pudendal artery. The first is the umbilical artery. And the umbilical artery usually undergoes certain changes later on in life, okay? If this is the umbilical artery, the proximal stem only of the umbilical artery persists in the adult, while the remaining part undergoes certain change. The proximal stem of the umbilical artery will persist and gives branches, we call them superior vesical branches, to supply the superior aspect of the bladder and the distal end of the ureter. It's called superior vesical arteries. While the distal end of the umbilical artery will become fibrous and covered by peritoneal folds and will be called the medial umbilical ligament. The medial umbilical ligament. So this is what happened to the umbilical artery. The proximal part will remain patent in the adult and gives the superior vesical arteries, while the distal part becomes fibrous and ascend toward the umbilicus covered by a parietal peritoneum to make a fold of peritoneum on each side of the inner surface of the anterior abdominal wall. We call them the medial umbilical ligament, and I think this is explained in the recording of the anterior abdominal wall. Regarding the uterine artery, of course, we discussed the uterine artery yesterday regarding its anatomy and relation to the uterus and so on. It's also a branch of the anterior division of the internal iliac artery, and of course we know the exact relationship between the uterine artery and the ureter, the water under the bridge, and this is a very important applied note, and we have to consider that while ligating the uterine artery to avoid injury of the ureter. Regarding the middle rectal, it's often in many people elusive. Okay, maybe not found in many people, but when present, it supplies the muscular wall of the lower part of the rectum. So the middle rectal is not found in all people. Okay, inferior vesicle, it's one of the arteries that supply the bladder. Okay, and also gives small branches to the distal part of the ureter. Then we have the obturator artery. This artery supplies the pelvic muscles and it crosses towards the head of the femur, also supply the head of the femur and supply the medial compartment of the thigh, the muscles of the medial compartment of the thigh, and even gives a small branch to the knee capsule. So it supplies the pelvic muscles, then it's more considered to the lower limb, supplying the head of the femur, the muscles of the medial compartment of the thigh, and also gives small branches to the knee capsule. Then we have the inferior gluteal, because the superior is branch from the posterior division, the inferior is a branch from the anterior division. This is one of the two terminal branches of the internal iliac artery. So the two terminal branches of the internal iliac artery are the inferior gluteal and the internal pudendal. And the inferior is the larger one, the larger in size, I mean. Okay, so the two terminal branches of the internal iliac artery are the inferior gluteal artery and the internal pudendal. The inferior gluteal artery is the larger terminal division. Then we have the internal pudendal, and we discussed the internal pudendal yesterday, that it leaves the pelvis through the greater sciatic foramen between the coccygeus and piriformis muscle, then winds around the ischial spine and enters the perineum through the lesser sciatic foramen. So when it enters the perineum, it passes through a canal in the obturator internus fascia, called the pudendal canal or the Alcock's canal. And when we discuss the perineum, I'm going to show you a picture of the Alcock's canal, where it's actually located. It's located at the lateral border of the ischiorectal fossa at the obturator internus fascia. Okay, we call that the pudendal canal or the Alcock's canal because it contains the internal pudendal vessels and the pudendal nerve. And of course, we mentioned the branches of the internal pudendal artery yesterday, the inferior rectal, the perineal artery, the posterior labial, the artery to the pulp, the deep artery, and the dorsal artery of the clitoris. We mentioned that yesterday. Some other notes regarding the pelvic vessels. We need to remember the branches of the external iliac artery. The external iliac gives two branches, the inferior epigastric artery and the deep circumflex iliac artery, because many questions in the exam can come like that. This artery is a branch of which artery? So we need to know that. So the branches of the external iliac artery are the inferior epigastric and the deep circumflex iliac, while the branches of the femoral artery are the superficial epigastric artery, the superficial circumflex iliac, the superficial external pudendal, and the deep external pudendal artery, profunda femoris artery, and the descending genicular artery. We mentioned something about the deep external pudendal. Can anyone remind me yesterday? Who remembers yesterday's session? We mentioned something about this artery yesterday. We mentioned that it supplies a certain structure yesterday. Who remembers? This structure starts with the letter B. Are you sleeping or what? No, B, not P. I said B, not P. No, not the bladder. The Bartholin gland. Bartholin gland, okay? We mentioned that it supplies the Bartholin gland, okay? Okay, so today, inshallah, you have to start reading and studying anatomy. Okay, so these are also some important notes regarding the blood vessels of the GIT. Okay, this is a collection of the blood supply of the GIT. I think Dr. Mawish has discussed that in the GIT recording, but this is also a very important table, okay? And also I want to say something, okay? We know that the GIT is divided into regions, okay, and the superior mesenteric is responsible for supplying the ascending colon and the proximal 2/3 of the transverse colon, while the inferior mesenteric is responsible for supplying the distal third of the transverse colon, the descending colon, the sigmoid colon, and the upper 2/3 of the rectum, while the middle rectal and the middle rectal is responsible for the lower third of the rectum, and the inferior rectal is responsible for the anal canal. What I want to say that in one of the exams, and actually it was my exam, okay, in 2017, he asked what is the blood supply of the ascending colon, okay? And he gives you in the options, in the same question, he gives us the superior mesenteric artery and the right colic artery. So what do you think we should choose, the right colic or the superior mesenteric?
Superior mesenteric.
No, we should usually, when he asks you about blood supply, you have to choose the direct branch. You have to choose the right colic. If the right colic is not found in the options, yes, then you have to choose the superior mesenteric. But as long as the right colic is found in the options, you have to choose the right colic. And of course, the same rule applied to all other structures. For example, if you ask you about the blood supply of the proximal 2/3 of the transverse colon, and you have in the options middle colic and superior mesenteric, what you are going to choose? Of course, middle colic. Okay, the same applies, of course, for all other parts of the GIT or any other organ. Okay, if you have a direct branch and the origin of that branch, you have to choose the direct branch. If the direct branch is not mentioned, then choose the origin of that branch. Okay, so this rule applies to the blood supply. Also, this is the venous drainage. Of course, most of the venous drainage respond to the arterial blood supply. For example, if the uterine artery is a branch of internal iliac artery, then the uterine vein mostly will drain into the internal iliac vein. But there are some exceptions. Like, for example, in the ovarian veins, as mentioned yesterday, the left one drain into the left renal vein, while the right one to the inferior vena cava. For the renal vein drains into the inferior vena cava, and there are some other things we need to remember, that the bladder has a vesical venous plexus which drain into the internal iliac vein. Also, the spleen has a splenic vein which drains into the hepatic portal vein. Okay, and the pancreas drain into pancreatico-duodenal veins and pancreatic veins which drain in the splenic vein later on. So these are some notes. Okay, the venous drainage is not as important as the blood supply, of course, but it's this is a collection found in Passe Marsogi that we can depend on while studying. Okay, let's practice few questions and then move to the pelvic nerves. At what lumbar vertebrae does the abdominal aorta bifurcate into the two common iliac arteries?
L4.
Yes, the answer is L4, option D. That's correct. The level at which the ovarian artery arises from the abdominal aorta is?
L1. Answer B.
It's the level of L2. Yes, L2. L2 is the correct option. L2, not L1. Okay? So that's the level of the ovarian artery. Which one of the following branches of the abdominal aorta is and unpaired L2, not L1, okay? So that's the level of the ovarian artery. Which one of the following branches of the abdominal aorta is an unpaired branch that arises from the aortic bifurcation?
E. Median sacral.
Yes, that's option C, median sacral, that's correct. Which one of the following branches of the abdominal aorta arises from the aorta between the level of L1 and L2 and forms 5 segmental arteries that do not anastomose? So your option is superior mesenteric?